Thank you. Good morning, all. I do want to thank the Senator for including me today, for allowing me to be a voice for so many that go unheard, or for so many that are no longer able to speak. As he mentioned, across the country, we have continued to see numbers rise on the opiate addiction and subsequent overdose death. So much so that overdose death has now become the #1 leading cause of accidental death in America, surpassing car accidents over 2 years ago. But specifically here in the state of Ohio, in 2015, we saw a 29% increase in overdose deaths. Excuse me. That allowed us to lead the nation in opiate overdose deaths. We beat California. We beat New York. We have to understand that this problem is not going away. As a matter of fact, it continues to get worse. As a chemical dependency counselor, I work with individuals each day that are battling for a life free from addiction. I work hard to try to educate people as best as I can on addiction. And I think that one of the biggest challenges that we have as a society is our ability to disassociate ourselves with the word addict. We dehumanize people that are battling addiction. And I am grateful for an opportunity today to remind individuals that these are human beings. This is human life that we are talking about. These are mothers, fathers, brothers, sisters, sons, and daughters. We are talking about people who are cared about, people who are loved. They'd be hard-pressed to find anyone in this room or anywhere across this state that doesn't know someone that has been touched by this epidemic. Just today, by the time we go home tonight and we go to sleep, there will be 8 families here in the state of Ohio that will be planning a funeral. Because that is the statistic, that is the reality that Ohioans have to live with. 8 people every day are dying of an opioid overdose. As a counselor at On Demand, I have the privilege of working with individuals that show perseverance, strength, like none other. To battle addiction is no small feat. It means waking up every single morning and making a choice. And sometimes that choice has to be made every hour. I see lives, families torn apart. But I also see hope. I see hope in recovery. I see hope in the evidence-based medical assisted treatment, in behavioral therapy, in intensive outpatient therapy. I see hope in people like Senator Schiavoni and others like him who have opted to take a stand here today in the hope of a new wave of awareness. We have to realize that what we know so far is not enough. I'm happy to be here today because this bill is proposing an opportunity for education and allow for data collection to provide us with the areas that have been hit hardest with this epidemic, to stockpile our arsenal so we can combat this enemy and determine the areas that have been hit hardest to begin to save their lives. Our current gubernatorial administration has made advances in legislation to help reduce the flood of prescription painkillers across our great state. And I thank him for that. But addiction is a multifaceted problem. And in 2012, when some of this new legislation began to take effect, up and through 2015, we did notice an 11% decline of painkillers prescribed in the state of Ohio. And on the surface, that looked like a success. But as the Columbus Dispatch reported, in the same time frame, we saw an increase of 10% of heroin overdose. That's because although we've been able to limit the prescriptions across the state, we never touched the addiction. Now, in 2012, fatal overdoses in the state of Ohio cost us $2 billion in medical cost and work that was lost. In non-fatal, it was $39 million. That averages out to $5.4 million a day this overdose was costing us. That was roughly 4 years ago. The problem has only gotten worse. We as a society need to become better educated on the disease of addiction. I think there is a common misconception that substance use, even periods of abuse, is the same as dependency. It is not. It's this thought that has led to a negative social stigma that follows every person that's battling addiction, much like a scarlet letter. It brings about shame, a reluctance to seek help. So when we do get someone that walks into our door, it is important we catch them when we can. It's important to understand how opiates work in our body. We need to understand how they hijack our neurons, how they produce 2 to 10 times the amount of dopamine that our bodies would naturally produce. We have to realize that it's much like a radio that's much too loud. We would turn it down. Well, our brain works in the same function. When there's opiates, there's too much, and our brains will begin to turn down the neurons, the neurotransmitters. Because we are overstimulating it with opiates, our ability to find joy, to find happiness becomes diminished. It's replaced with a thirst that cannot be quenched. The high that many people associate with addicts actually goes away very early on to the disease because of our ability to gain a tolerance to this substance. Most people will continue to use because we have inadvertently turned down or sometimes even shut off some of those neurotransmitters, and our need for dopamine has increased. What we're left with is a half-life, a life lived in shadows. It's full of despair, misery. The use will continue. They use in the hope of warding off the withdrawal sickness, or in the hopes of maybe feeling normal, if only for 20 minutes. It is a hell that I would wish upon no one, and unless you've seen it, unless you've known someone that has gone through it, you cannot fathom. As hopeless as that sounds, we have found methods. We have found medication that has been proven to give people their lives back. But because of a lack of financial resources, or because of limited medical insurance, many are left with despair. I think of individuals that have come to our office that have overdosed 1, 2, maybe even 3 times because they were not able to get into a treatment facility when they were ready to get clean. Recently, $12 million has been allocated to the state to help combat this epidemic. It's roughly $75,000 per county. That will allow us to treat 4, maybe 5 people. And just to put that into perspective, I come from Warren. I live in Warren, Ohio, in Trumbull County. And in March of this year, we had 189 overdoses, 26 of which resulted in death. We need help. I want you to imagine yourself if you were standing in a river and someone fell in, they began to drown. I would hope most of us would reach down to save them. And as we put them on the riverbank, we turn around and 2, maybe 3 more fall in. Yes, of course, we're going to want to know why people are falling into the river, but that does not take away that they are dying. We need help. The people that are saving these people every single day, that are in the trenches, that are in the water, that are pulling these people out, are first responders. They need help. This bill has allocated funds to them in a way that I have never seen a bill done before, whether it be New Jersey, Indiana, or even Georgia. And therefore, it's very easy for me to get behind. Because those individuals that are in the river, that are saving people from drowning, are exhausted. They're tired. When they put them up on the riverbank to save them, if the funds are not there, if the ability for treatment is not there, they will fall back into the river. And now we have just created an even greater problem. Now, yes, the work that has been done upstream to limit the prescriptions has been wonderful, but we cannot allow it to take place or take away from what's facing us every single day. In closing, we need to ask ourselves, everyone in this room, and everyone across the state and across the country, if we had a power, we had an ability to save a human life, would you be able to look them in the eye as they were gasping for their last breath and tell them no? Are we able to determine who deserves life and who does not? Because by denying this bill, that is essentially what we are doing. This bill is, as he's mentioned, requesting only 10% of our rainy day fund. And I think that we can agree that it's not raining, it is pouring, and there is a flood. And more people are dying every single day. Children are left without parents. We are in the midst of a health crisis, like we've never seen before. And all we're asking for is a little help, a call to arms, if you will. We need to put aside any party differences that we may need and take the necessary steps to stop human lives from being taken. 2014 and 2015, Ohio led the nation in opiate overdose deaths. 2017 is not shaping us to be any better. So I ask you, how many more must die? If not now, then when? Thank you.